Samina Ali. I'm a pediatric emergency physician at the Stollery Children's Hospital in Edmonton and co-chair of the community of practice with Ashley. And I also have Dr. Melissa Chan with me here, so I'll let her introduce herself.
Hi, I'm Melissa. I'm one of the Peds Emerge docs here at the Stollery as well.
Great. And Lisa?
Hi, it's Lisa Stromquist from the CAPHC office. And I don't know if there's anybody else online.
The caller 01, but I don't know who that is.
Okay, well that's fine. As people join us, we can ask them to introduce themselves. So did everyone get a chance to read the agenda and summary, and are there any changes or anything that should be added?
I think it was good.
All right, I will take silence as confirmation. Okay, so like last time, what we're going to do is actually start with the presentation today, and then we'll move on to our updates with the work. So I'm going to turn it over to Kathy and Allison to present for us.
Thank you so much. I'm clicking on share. A very tiny box again.
Oh, actually, we saw it. I saw it before, and it was big.
There you go.
Getting there. I think it's just slowly chugging away, right? I'm seeing half a box.
Last time, Kathy, it took a little bit to get the full image.
Seeing part of a box, and I have a flashing little hand thing. Shouldn't sing along for you either. Sorry, guys. I don't know why it's not loading this time. What are you guys seeing? I see half a box.
Yeah, I see half a box too. But I like the musical interlude.
Okay, let me stop sharing and try it again. Oh, now I'm stuck. Okay, this is not good. Oh, hang on, hang on. Oh, it's downloading. It's coming very, very slowly, I think. Okay. I only have 2 slides now showing. What am I doing wrong, guys?
I can't see anything yet.
Yeah, we're just seeing the sort of the way to view your screen.
Okay. I'm not sure what else I can try here because I'm starting to see slides, but
all right. So what we can do is
you guys aren't, and I can't see anything else.
So what we can do is I can run the slides for you. It's not as the most ideal, but it's at least everybody will.
Yeah, we can just say the word next slide.
Yeah.
I'm just kind of stuck here now on a screen where I can see my front slide and I can't see anything else. Allison's just going to quickly open up her laptop here so she can actually talk from that since we don't have the slides here. Sorry, it worked like, what, 3 minutes ago?
Yeah.
Kathy, I see the first slide.
That's all we can see. Can't see all of our slides.
Yeah, that's from my screen. You're seeing it, Leanne.
Right. Okay.
Okay, perfect. Okay, we've got ours here now, actually.
Oh, yeah, it's showing up.
Okay, yeah, it's showing up. And so our first slide there, go ahead. So Allison can speak.
Okay. So today we're going to be talking about our project about the creation of an ebook for parents about pediatric chronic pain. And so in our, moving on to the
next slide.
So do you want
our outline? We're just going to be giving a brief overview about pediatric chronic pain and discussing our research project and the development of the ebook itself. And we're also going to be providing some images so you can see what the ebook looks like. And then I'll be briefly discussing the final phase of our research project. So I'll just hand it over to Kathy.
All right, so we'll go to the next slide. And of course, I think we all know this, what is pediatric chronic pain, but I hope you can see the artwork. This is actually a picture that was done by one of our teens that hangs here in our clinic talking about chronic pain because it really isn't a well understood health issue. I think we all know that. Sarah King's work looked at the epidemiology between 11 and 38% overall across all of the diagnoses. Certainly it affects girls more than boys in the adolescent age group. We do think the testosterone is likely protective, but we really don't understand quite why the epidemiology is different during these age groups. And of course, we know the incidence increases with age. That said, we do see kids as young as 4, 3 in our clinic, but certainly the vast majority of the children that we see are adolescents. Next slide. So again, this is another piece of art that hangs on our wall here that was done by one of our teams. We know that the effects on children is things like increased rates of school absenteeism, and certainly in our program that's a red flag to get them in sooner. There's some good research from Paula's group looking at how they lose their friends and their peer relationships, which we know in an adolescent time period that's a really big problem when you lose your peer group. Certainly it leads to feelings of isolation. Anxiety and depression are quite common, probably 5 times more common to see kids with anxiety in a pediatric chronic pain clinic and 7 times more common to see depression. And it's decreased ability to participate in life, so they don't do activities, they can't do their hobbies that they do. So next slide, we wanted to look at a research project looking at what does this population need? What do we need to do to help these kids? So if you go to the next slide, I was very fortunate to be able to do my thesis back in, I collected the data in 2008 and we were published in 2010, looking at what do the parents expect from their first visit to the chronic pain clinic. And really what these parents expect is a diagnosis. And sadly, they'll have seen numerous healthcare providers, up to 12 healthcare providers, on average 4 healthcare providers, before coming to see us, and yet they still don't have a diagnosis. They don't know how to help their children cope. They don't understand the effects of pain on their child's mood and on their body, and they really wanted treatment information, and they wanted it in multiple ways. They wanted books. They wanted to meet other parents, but they really wanted some reading materials to understand their child's chronic pain. So with that, we then were able to put together our research study and hire Allison as our research coordinator.
So this is just on the next slide, entitled Research Study at the top. So briefly reviewing our research study here, the overall purpose was to create and evaluate art-based knowledge translation tools.
Sorry? Yeah. Oh, okay.
To create and evaluate an arts-based knowledge translation tool, which is the eBook, with parents who have children with chronic pain based on their specific health needs. And the overall aim of creating this book with parents was for it to be accessible, so parents could find it online and it is easy to read and it would be meaningful to this population. So it's not a book created by health professionals based on what we think parents need to know, but it's parents telling us what they want information to be included in the book itself. And they also wanted it to be easy to read and not full of confusing medical jargon, and as well as to increase their knowledge about chronic pain in the child. So just moving on to the next slide. So to be able to create this knowledge translation, we had to conduct a multi-phase research study, and we did this in 3 distinct phases. So in phase 1, I conducted semi-structured interviews with parents, and then following that was the development of an ebook. And then moving on to phase 3, it was the evaluation of the ebook itself, and this whole process has been taking place over about 2.5 years, and we're just coming to the close now. So if I could just get you to move on to the next slide, and this is just a basic overview of phase 1. So this was a qualitative descriptive study, and the purpose of this phase was to understand parents' experiences of having a child with chronic pain, just to really understand their experiences and to contextualize the book and the story itself. So over about a year, I was able to recruit 13 parents, and that includes 12 moms and 1 dad. One dad. And the interviews ranged from about 48 minutes to 120 minutes. So I was able to collect a lot of rich data, and some of these interviews were quite emotional as and parents were very open and welcoming to me asking them questions, and we're very excited to have such a product created for them and for other parents to help them out. So I'm just going to move on to the phase 2. So once I collected all the data, we were able to create what we call a composite narrative based on all their experiences together. And once the storyline was created, we were able to integrate their stories with the best available evidence into the storyline itself. And that process took about a year or so. And once the initial product was created with the pictures and the integration of the definitions and everything, we also had to convert the product itself into multiple formats just to make sure that parents, depending on what type of technology they would have access to the ebook itself. So yeah, to create the ebook, we worked with several people, so that included an artist, stakeholders here at the Chronic Pain Clinic, a creative writer, and as well as two publishers to develop the final product. So if I could just move on to the next phase again. Oh, here we go. So the final product itself, with the illustrations, it ended up being 38 pages long. And of course, the storyline that I'll show you just shortly here is based on the phase 1 experiences of parents and includes a whole bunch of definitions that parents wanted to learn about, as well as exercises for families that they wanted to learn about, for example, coping strategies and information about other pain clinics across Canada. So moving on to the book. Ta-da! So this is just one picture out of the book itself, and this specific page, as you can see, just has an illustration on the left and a basic storyline on the right. And then on the next page, you can see this is just the word cognitive behavioral therapy has a round dot with an I in the middle, and parents can actually click on that definition itself, and then a definition pops up to explain what the definition means. And then, so there are several definitions throughout the entire 38-page book that includes such information that parents want to learn about. And then there were 3 main exercises that we included in the book itself, and I'll just move to the slide. So this one, the exercise number 1, parents could click on this and learn about happiness, values, and goals. So we just included some questions that they can reflect on about their child and about their own values in regards to their chronic pain and their chronic pain care. And so once this final version of the chronic pain book was created and edited over a year or so, we had to move on to phase 3, which is the evaluation. So I'm just moving on to the next slide. So yes, the evaluation of the product. So this is just coming to a close right now. So what we did was an online survey, just looking at usability of the tool itself and knowledge gained from parents. So we emailed it out to parents of the clinic here, and we got several responses back, and I'm just looking and cleaning the data right now. I can't, of course, tell you about any of the results because I haven't analyzed anything yet, but yeah, we were very excited that we're finishing the research project right now. Yeah, of course, I just wanted to say thank you to the Stollery Children's Hospital Foundation and for WICRI for funding this project. And of course, thanking the families for participating in this project and being willing to open up their schedules, their very, very busy schedules, as well as their personal experiences, so we could create a product with them and for them that's meaningful for this population.
Oh, yeah, just a couple of things, too, that we've included in the book, right? We have a link in the book to all of the pain clinics. We wanted to make sure that families could then, if they weren't in our catchment area, could certainly link on it. And we chose the one out of the Pain Coalition because that's the one that's probably the most up-to-date, but that's certainly something down the road that hopefully CAPHC can have on our website as well. And then Dr. Shannon Scott's research projects are listed there. And then we just have our references that are in there. All right, we could close that PowerPoint then, or unless you want to go back and ask any questions about any of the pages.
So are there any questions for Allison and Kathy?
Comments?
I think it's great. Kathy, how are you going to tell us about it when it's available and ready to go?
Well, we're certainly going to be able to send multiple formats. What are we looking at? PDF? Well, Allison owns fonts now. She's had to buy fonts. We're going to be hosting it on websites. We're going to tweet it out. We're going to do multiple different ways of trying to share this.
And just
Kathy, in your clinic, what would you see as, like, are you going to link parents to this when they're referred to your clinic or when you have initial visit?
Well, it's going to be on we have our own clinic website now too, so it'll be on our clinic website.
Okay.
Hi, it's Krista. I have a question. I don't know if you can hear me. Hi. I think this looks really good. I just wondered if you'd considered piloting it in other centers to just see how transferable it is. And I just noticed that the one line in the story mentions a weekly pain class, and I just wasn't sure if you know, how transferable that might be to other centers in terms of setting up patient expectations.
Right, and I mean, it really is. It is a product that was designed locally with the hope that it will impact a wider area. And certainly one of the other things that we've been working on, Bruce and I have been working on, is trying to help other sites set up a similar group CBT program to what we have here at Pain 101. I mean, parts of it probably won't necessarily fit for everybody else's clinics, but certainly globally the questions that the parents were telling us of, I need to understand a diagnosis, I need to understand coping strategies, I need to know what CBT means, because whether you do a group CBT or not. But again, the story was driven by our parents here whose kids attend group classes. So we went with their story.
Great.
Awesome. Any more questions before we wrap up with these guys? Okay, great. Thank you so much for sharing your work with us today, Allison and Kathy. It's super informative. So I think we're going to move on to the work group updates on the chronic pain and the acute presenting pain. So the work for the chronic pain is pretty brief, and I just have one question for the group. So I think I'll go first, and then I'll turn it over to Samina to work on the acute presenting pain toolkit. So I sort of contacted through email all the people that indicated that they wanted to be part of the chronic pain work, sort of sorting out what type of box we're going to be doing, who are our target audiences, what do we want to be in it, and that's something that we had discussed in our last meeting with the larger COP. So that work is well underway in terms of collecting resources and working with our team to eventually review the content for a fit with CAPHC's work. But one question I have for the people on the call today, and specifically anyone who is more of a frontline clinician or maybe in the emergency department, are there any types of resources, or what would you expect to see in this? Because everyone that's on the chronic pain toolkit for CAPHC is a chronic pain expert, so they're more in depth with the content. But if chronic pain is something you don't see on a frequent basis, what type of resources or information would you want to see?
I think from my point of view, so it's Melissa speaking, I think how to, things that we can put in place in terms of, I think I mentioned this last time, like non-pharmacologic options, any other resources that you think would be good for families while they're waiting, especially if they haven't already been referred to chronic pain kind of services. And then other supplementary resources, I think, in terms of what kind of patients you think would be good to be referred to a chronic pain specialist, in terms of what criteria people are looking for. I know that's going to be very site-specific, but general principles might be helpful.
Okay, so pharmacological and non-pharmacological like management strategies, family resources, and then criteria for referral to a specialist. Is that correct?
Yeah, that's kind of some of the things that I think me. I don't know what other people think.
Okay.
Yeah, I think I would agree with that. My name is Rosa. I'm from the Shriners Hospital, and I would like to see some kind of tool that will indicate us, okay, this person is actually having chronic pain and we need to refer it to a specialist or something. I'm on the nursing unit.
Okay.
The clinical. So I think that would be very helpful. Something that we could, you know,
so it's like a tool for chronic pain, and then sort of at what point is there an indication for a referral to a specialist?
Yes.
And hello, it's Evelyn from St. Justin, and probably something helping the physician to what to do in the meanwhile, because sometimes it can be long before the patient will be seen by the chronic pain team.
Okay. Okay, just writing that down. Okay, great. Any other recommendations before we move on?
Actually, oh, sorry, go ahead, Leanne, you go ahead.
Yeah, it was Leanne from the Stollery. And just to add to that, you know, just to make sure that while they're waiting, everything has been checked out to rule out anything else, if that's indicated, because sometimes referrals are made, just so that I can sort of briefly see, and really the due diligence prior to arrive at the conclusion that it is a chronic pain and not possibly something else. Sometimes that'll impede it once it does reach the desired referral. And you know, if it's not clear that it's actually chronic pain and not due to something else, or just some of the basic stuff done, because I think people tend to just want to hand it to somebody else.
Okay.
Kathy, do you think that's a fair comment?
Yeah, we call that medical closure. Yeah, we want to make sure that, you know, one of the things we always say in our program is I never want to diagnose a brain tumor in a chronic pain clinic. So having them see the appropriate specialist before, if possible. I talk to people a lot about, did you send that kid to neurology? Have you talked to GI about that kid? Those kinds of things. So, but again, a lot of us, I think if we just develop an algorithm based on our referral criteria, because I suspect most of our clinics, we have a very similar referral criteria for having kids come into our program. So we should be able to come up with an algorithm of when to refer to chronic pain based on, like we said last time, with understanding the red flags.
Yep. Okay, great. That's perfect. Yeah, I just wanted an understanding of what frontline clinicians were looking for to ensure that we captured that in the chronic pain discussion when I have a separate call with the people that are on that working group. Okay, that's great. And if anyone thinks of anything else, please feel free to email myself, Samina, or Lisa to let us know your thoughts. With that, I'm going to flip it over to Samina to discuss the acute work.
Hi, can you guys hear me all right?
Yes, I can.
Yep.
Super. Thank you. So just actually one more thought building on what Kathy and Leanne were saying about chronic pain. I would really like to reiterate or state that maybe in a different way in terms of what resource I was imagining I would want. And I envision a presentation or a PowerPoint presentation, an educational resource for frontline acute care clinicians that says, basically the presentation is called, how do I make sure I haven't missed a medical diagnosis before I refer someone to chronic pain clinic? Because I'll be blunt, that's where my fears lay. So one part of my problem is how do I be sure that I've looked for all medical sources of chronic pain and that need to be diagnosed, like Kathy's example, brain tumor, etc., as opposed to chronic pain causing diseases that are also medical diagnoses. And then the second piece is what's the threshold for referring? So at what point when the child is in the emergency third, fourth, fifth time, when do we say that our acute care resources are not meeting the needs? But the big one, I think, for clinicians is what do I have to do to be sure I haven't missed the diagnosis?
Okay. Sounds good. Thank you, Samina.
Good. And with that, I'll talk a little bit about the acute pain side. Pardon me. And with apologies, I haven't reached out to our subgroup or our subcommittee core volunteers recently. There's been a few other things ongoing that here locally that have precluded that. So my apologies, and I will spend the time between this call and next call touching base with you. Just to quickly remind ourselves, our group had, as a whole on this call, had decided that we thought we could break up the core themes into three main areas. One was acute presenting pain, so illnesses that or injuries that come with pain at diagnosis. So examples would be fractures, sprains, migraines, otitis media, that kind of thing. The second was post-operative pain, with the most common diagnoses being post-appendix removal, tonsillectomy, fracture repair, ENT surgery. And then the last was acute exacerbations of common chronic conditions. And the three examples our group had come up with is sickle cell cancer and rheumatologic disease. And then we had decided we would likely develop 3 separate toolkits for each of those, with some of the key resources in each of those would include a core document for how to manage that pain, but with the special considerations section, and then different resources in terms of protocol, similar to the procedural pain toolkits. So I'm trying to think of examples, educational examples, parent resources, the PowerPoint presentations, etc. Does that sound right to the people who are on this call? Is that a fair summary?
Yeah, I think
that sounds good.
Okay, great. And there had been a few people who had emailed myself and Ashley and Lisa about potentially leading some of these areas. And I'm wondering if anyone on the call had a particular interest in any one of those 3 categories, either acute presenting pain, post-operative pain, or acute exacerbations of chronic conditions, if they would like to co-lead one of those boxes. And I know, for instance, Evelyn, you had put your name forward for one of them, but you may or may not remember that. But please feel free, if you can, anyone on the call that finds any of those areas interesting, if you'd like to help us co-lead. They're big areas, so we were thinking we'd probably have 2 co-leads per box, and then myself and Ashley will be there, of course, to support you as well. So I'll just stop speaking and see if anyone on the call has an interest in one of those.
Yeah, so, if I remember well, Samina was to co-lead with Dr. Navin Punai the acute presenting pain, and that's actually the one that I was interested in.
Excellent, thank you. Thank you so much for that. Anyone on the call interested in the post-operative pain, where they feel that's where they would add their expertise is most well aligned with that, or their interests?
Paging Leanne Wakanchuk. Paging Leanne Wakanchuk.
Yeah, well, but I'm part-time. So I really sort of hesitate to take on as a co-lead.
Okay.
You know, I'm calling in from home today, which I mean a lot of other people do, but you know, I'd need some strong support because I have, you know, 0.6 to do my job, and this is something else on top of several other committee commitments. So, you know.
What I'll do is I put Leanne in parentheses. How's that? And what I mean by that, what I mean by that is we will continue to identify co-leads, but knowing that you have such tremendous expertise in this area, maybe we can do targeted emails to you to say, Leanne, do you have X, Y, or Z resource that you could easily share, and lean on you less to create new resources. Is that fair?
Sure. Okay. No, that's fine, Samina.
Thank you for agreeing to being voluntold.
Yeah, thanks, Kathy.
She's going to smack me when she comes to work tomorrow.
There's
I'll
a
help.
thank you so much for that. There's enough. We also have our acute exacerbations of chronic conditions, and then post-op, we're still looking. So if there's anyone else on the call, I don't want you to be afraid or overwhelmed. You wouldn't do this by yourself, and our first step would be to try to find the resources within our community. And then if we're unable to find anything, then we might develop something new. But based on our previous work, we were able to probably find 80% of what we needed within our community.
Hi, I'm Rosalie Chapardello. I work as a clinical nurse specialist at the Shriners, and I would like to help with the postoperative acute pain. I don't want to be the lead on this either.
Okay.
I'm kind of new to
Sorry, go ahead.
but I would like to help.
Wonderful. Thank you so much, Rosa. And we can, I don't want you to be afraid of those titles. We will do this collaboratively for sure. And at any point, yourself, Leanne, or anyone else feels that it's asking too much of you, just please tap us on the shoulder and say, I cannot do this, or I need someone else to do this. That this is, we fully recognize this is a community of like-minded volunteers, and that we all have other personal and professional responsibilities that we're obligated to fulfill as well. So thank you for offering, and I promise if at any point any one of our volunteers feel they're leaned on too heavily, to just let us know and we'll pull back for sure.
Tina, it's Kathy. There's
Yes,
one or two advanced practice nurses at Alberta Children's Hospital in acute pain, right, Leanne?
Yeah, they're sharing a full-time equivalent.
Yeah, so we could maybe tap into some of their resources down there as well.
Okay. I'll email Kathy the contact information for them, yeah.
Yeah, and there's got to be people at the kids who would step up and do this too.
Yeah, I have the names of the two NPs there that share the acute pain position right now, so
Leanne,
I could email them.
That would be wonderful, thank you. Yeah, why don't I send you an email, Leanne and Kathy, and then maybe if you forward it to them and CCS, then we'll all be in the conversation together. That would be wonderful. Thank you.
Sure, because right now we're working at the Stollery on a joint sort of parent information pamphlet for like patient-controlled analgesia. So we are trying to look at some collaborative stuff with them. So I'm sure that they would, you know, maybe be interested in joining.
Okay. Okay. If anyone on this call wishes to work on the acute exacerbation of chronic conditions, please let me know, and I will connect with Ashley, and maybe we can email our chronic pain group. Many of them were unable to make the call today, and see if any of them would find this interesting to focus on. We can maybe get some co-leads from there. Sorry, go ahead. Oh, okay. Maybe we just caught somebody having another conversation. Sorry. I'll email those individuals and see if we can engage them there. And then does our group made a point that when we design these 3 boxes that we make sure to integrate coping mechanisms, psychological and physical strategies into the toolkits. Without committing to leading any of the boxes, would anyone on the call like to identify themselves as someone who has expertise or knows where these tools would be that we could email you just specifically with that question?
So Samita, just to clarify, so you're wanting someone to take one of the aspects of the pharmacologic, psychological, and physical?
Thanks, Leanne. So what we wanted to do is our group wanted to make sure that each of these 3 toolkits had a section specifically dedicated to there are psychological and physical things that we can do. So there are things not related to medications that can help these patients as well. So and so someone who feels like they own that area, knows that area, and would be able to provide us with information about that.
Well, I certainly know, like with our child life people and our rehab people, I'm sure we could compile resources. There's some very basic things that I use, but I mean, I don't think that's all inclusive.
Okay. No, that would be wonderful, Leanne, and that would be the extent of what we would want our group to help us with, is just to identify what resources are easily collected. Like, so for instance, say, oh, I know that Alberta Children's has an excellent tool for X, or Stollery has a wonderful explanation of how to use Y therapy, that we just get a copy of. That's about it.
Sure.
So, thank you. I'll put down your name, and I'll put Child Life Rehab next to it, as well as other groups. Yes.
Mina, it's Ashley. Alana Jackson is on the Chronic Pain Toolkit, and I'm sure she would be open to sharing some of her resources, and/or we could probably cross-post some of the resources from the
Chronic Pain
acute, or the acute toolkit that we developed before, because she helped us with that.
Excellent, thank you. So when I work on this piece with our group, I'll reach out to Alana and Leanne. Thank you for that suggestion, Ashley.
No problem.
Okay, good stuff. I think that gives us a bit of direction for where to go with these kids next. The other things our group had talked about was trying to link in with Canadian Pediatric Society. And Evelyn is on the call, and she's having great success leading that with CPS. And so, Evelyn, would you mind updating our group how that's going? And it doesn't have to be a big new update, but I don't think that even some people on the call may not even know what you're leading over there.
Yeah, so I'm on the acute care committee at the CPS, and we did a proposal to the CPS board to do a document on pain management for minor procedure in the emergency or in the clinic, and we did that with Samina and with the emergency committee, so and with the hospital committee as well. So we're waiting for the answer still at the moment, so I don't have their response yet at this time.
Okay, thanks, Evelyn. And if I remember correctly, the goal was to make 2 documents with CPS, one for procedural pain and then one for presenting pain. Is that correct?
Yes. So for the we did at the moment we just did the proposition for the procedure pain, but then we want to do, after it's accepted, the one for acute presenting pain.
Excellent. And Evelyn is very open to integrating links to the CAPHC toolkits that our group here has created. Yes. So it's a wonderful way for us to cross-reference each other's work and increase the awareness. So the CPS statement will have CAPHC links, and then CAPHC can integrate the CPS practice point into our toolkit. So it's a wonderful national or between national agency extension of the work we're doing. So we're very excited. And thanks, Evelyn, for leading that.
It's a pleasure, and I just hope we will get accepted.
Yeah, I hope so too.
But I'm sure that we will, yeah.
Good stuff. Thank you for that update. The other thing our group had talked about was linking to the TREC bottom line recommendations. And so for those of you who are newer and don't know TREC, TREC is an organization that is an acronym for Translating Emergency Knowledge for Kids. Their website is trekk.ca. And they have really, really interesting tools and resources for all clinicians providing emergency care in all settings. It's not meant for tertiary care centers, pediatric emergency physicians. It's meant for all practitioners. And, oh, thank you, Lisa, for putting that up. And so within this, you can search for tools, and our group, so members from our CAPHC group here, we have created bottom line recommendations for TREC, and TREC has tweeted out and shared the CAPHC toolkits that we've created as well. So we have a really nice synergistic relationship with TREC as well. And right now, TREC has a document for procedural pain, which is a bottom line recommendation, and currently documentation for presenting pain is under review by their executive steering committee. So that one will hopefully be ready within a month or so, and then we'll be able to include that in our CAPHC toolkits. And then TREC has been very good. When our toolkits are ready from this group's work, they'll share our toolkits on social media as well. So that is continuing to move in the background as well. We're having good progress with that. And I don't know if Dr. Punai is on the call. I think he's not today, But I can speak very briefly to an effort that Dr. Punai is making, and he's developing, just in the very early stages of developing a clinical practice guideline for musculoskeletal injury-related pain in children. So this will be very relevant to our acute presenting pain box, and he's trying to get national endorsement and concomitant publication in multiple journals so that for both emergency, pediatrics, community care. And that will be a tool that he will be able to bring to our group as well, and that we can integrate into the toolkit. So outside of our group's meeting, there's a few offshoot projects that are being led by members of this community of practice that will feed back into the group. And he's also very open to integrating the CAPHC links for our work into the document so that, again, it's broadening the scope and reach of this one. So I think I'll stop there because that's lots, and I'm very excited that we have 2 plus half leadership volunteers for our toolkit, and also for the non-pharmacologic piece as well. So what I'll promise our group is that for the next 4 weeks you may receive targeted emails from myself and the co-leads asking if you have specific resources for these toolkits, and we'll take it from there. So I'll turn it back to Ashley and Lisa, if that's okay.
Thanks, Samina.
Ashley, just before you start, I had a comment. It's Lisa. I just wanted, I find it really, really exciting when I hear about the work with CPS and the work on clinical practice guidelines and the TREC and all these collaborations. And that's kind of the point of having a community of practice, is so that all of these projects, all this research, all of this work that's ongoing across the country can be linked together really easily, or more easily than it might be otherwise, and that we can work on each, build on each other's work, and instead of starting from scratch all the time. And it just, these sorts of things make me very excited. The more we work together, I think the better it is. So I just want to thank everybody for all that.
Absolutely. And I think that's everything for today, unless there's any more comments or questions about the work that we're doing.
I have a question regarding acute pain post-operatively. It's Rosa again from the Shriners. I'm wondering if you've looked at management of medication side effects, and I'm talking more for our orthopedic side. We're having quite a few problems after the post-operative pain, is getting a grasp of nausea, vomiting, and constipation. So I'm wondering if we're looking at that too.
Thanks, Rosa. That's a really interesting point. So how to manage the focusing on the side effects of the analgesic treatments that we actually use. And no one has brought that up before, but you're absolutely right. We know from our families that that's one of the #1 reasons why they discontinue treating a child's pain, is that the side effects and adverse effects outweigh the benefit of pain management at times. So thank you for that. It wasn't brought up yet, but I think it's a really good point, and we could create something to help with that.
Thank you.
Great. Well, if there's nothing else, then we'll end 15 minutes early. And again, if you have any resources or questions that you think of, please feel free to reach out to Samina, Lisa, and myself. But otherwise, we will see you next month, and stay tuned for other emails regarding your subcommittees.
Thanks, everybody.
All right, then. Thank you.
Have a good day.
Bye.
Bye.
Bye-bye.
Bye.
Bye-bye.